transmitiendo nuestra comunidad al mundo.
So good morning, everyone. Welcome to our Facebook Live session from here in Nogales, Mariposa Community Health Center. I'm Eladio Pereyra, the Chief Medical Officer. I want to thank Edgardo and Mariposa for supporting this activity. I want to thank our Head of Department of OBGYN, Dr. Cystalynn Woodard.
Hello.
Who's going to talk to us about a few areas. So, Dr. Woodard, welcome.
Mucho gusto.
Mucho gusto, gracias por venir. Mi nombre es Eladio Pereyra, el director médico, y tengo el gusto de tener a la doctora Woodard en el departamento de obstetricia y ginecología de Mariposa. Tenemos varios tópicos para hablar. So we have a few topics to talk about. So Dr. Woodard, the first one is talk a little bit about the services we do and the kind of practice you do. We see GYN problems, common complaints. Can you tell us a little bit about the kind of things you see in the practice, and maybe also tell us about the kind of things you have available to investigate those complaints?
So first off, we do well woman exams, which is just regular screening for women, screening for cervical cancer, and if they're at an appropriate age, also screening for breast cancer. So también hacemos evaluación para las mujeres en exámenes anuales y para chequeo del cáncer del cuello de la matriz y también de cáncer de los mamarios. So ordenamos la mamografía, hacemos los exámenes pélvicos y en adición también cuidamos las mujeres embarazadas. So we also take care of pregnant women del principio del embarazo hasta el parto. Y so that's from the beginning of pregnancy all the way to delivery.
Okay.
So
the annual exam, so you take a history and then you do certain exams, and then depending on the age and other factors. Pap smear we're still doing Pap and test for HPV. So depende de la edad y otros factores. Hacemos la prueba del cáncer cérvico. Está la prueba nueva del virus papiloma, que es responsable por la mayor parte de los casos de cáncer del cérvico. Las recomendaciones de la prueba del cáncer han cambiado un poco.
So sí, la vacuna contra el virus papiloma humano antes nomás fue para las mujeres menos de 27 años. Pero en 2019 aquí el gobierno aprobaron la vacuna hasta la edad hasta 45 años. So prior to 2019, HPV was only recommended for people up to the age of 27. And then recently they've extended that to age 45. So ya todavía se recomienda que lo recibes entre 11 a 26 años. Pero también si hay mujeres que tienen abnormalidades en sus papanicolaos o unos riesgos, hablamos con ellas y a veces damos la vacuna hasta 45 años. So now, though it's still recommended between the ages of 11 and 26, we'll still give it to women and talk to them about the risk factors if they need it up to the age of 45. Especially if you had like an abnormal Pap smear, we do recommend that you get your HPV vaccine. It's most effective when given prior to any exposure, which is why we give it so young. So es mejor si uno recibe la vacuna antes de tener contacto con alguien que tiene el virus papiloma humano, y eso es porque lo damos tan joven. Si se da antes de 15 años, nomás es 2 vacunas. Después de 15 años es 3 vacunas.
Right. So we emphasize the importance of getting the vaccine. Every person should get it to prevent. It's really important to emphasize that this is the agent of cervical cancer. So if we're able to prevent the infection, then the chance of cervical cancer is significantly reduced. So that's important for our followers to know. But even if the person has engaged in sexual activity, the vaccine is still recommended, right, Dr. Woodard?
Yeah, the vaccine is still recommended because it still reduces your risk of having severe abnormalities on the pap smear. If you've had an abnormality, it also reduces the chance that you'll continue with that abnormality on repeat pap smear. So it's still recommended. And the nice thing about the HPV vaccine right now, it protects against 90% of HPV infections. So
la vacuna protege contra el cáncer de cuello de la matriz, muy efectiva. Antes de 15 años, 2 inyecciones, después son 3. Pero aunque el paciente haya empezado su actividad sexual, se recomienda que se administre la vacuna porque, como dice la doctora, reduce anormalidades en el pap smear. The other thing is, even if you get the vaccine, you still need to come for your pap smear.
Yes.
So some people think that, oh, because I got the vaccine, I don't have to worry about that. So you want to expand on that?
Yeah, so the vaccine is nothing is 100%.
Right.
And so we are reducing the chance of anyone having problems. However, it doesn't completely eliminate the risk.
Right.
So because of that, we do recommend that people start their pap smears at age 21. So se recomienda que uno empiece los papanicolaos a la edad de 21 años. Y la vacuna es muy efectivo, pero no es 100% seguro. So es importante que uno empiece los papanicolaos a 21 años. The wonderful thing about the vaccine, though, is it's also available to men. And it's recommended that men get it too. They're usually carriers. Most of the types of HPV that cause cervical cancer, men do not have symptoms. So, también se puede dar y se recomienda que los hombres reciban la vacuna porque ellos pueden ser como portadores del virus. Y el tipo de virus que afecta a las mujeres en el cuello de la matriz, usualmente los hombres no tienen síntomas. So, lo pueden dar a las mujeres.
Yeah.
So.
Yeah, absolutely. So the men need to get it too because they can transmit it to the woman. The other thing about the vaccine is that it has the vaccine protects against warts. So we talk about cancer, which is obviously the most important one, but warts can become a problem too for some people, particularly in the future. If you become immunocompromised, the warts can be very extensive. So vayan verrugas, so la vacuna es efectiva para reducir el riesgo de verrugas en el área genital o en el área donde haya exposición. So, imaginen en el futuro si el paciente recibe medicinas para bajar el sistema inmune, las verrugas se pueden convertir en un problema, son más grandes, pueden causar síntomas obstructivos en la uretra, en la vagina, so, protege de la tos.
Y también pueden ser cancerosos también.
Y algunas de ellas pueden convertir en cancerosos. So the other thing about the vaccine, Dr. Woodard, it really doesn't protect against other sexually transmitted infections and sometimes and against pregnancy.
Correct.
So, can you talk a little bit about the other sexually transmitted infections that you see in practice that we see commonly? Maybe talk a little bit about the treatment and so on.
So, uno es clamidia, y ese es el tipo de infección que es más común aquí en Nogales y esta área. Y no hay síntomas usualmente hasta que está más avanzado. Y puede causar infertilidad a las mujeres. So, siempre se recomienda un chequeo cada año a lo mínimo para eso, y también con eso está incluido gonorrea. Gonorrea no es tan común, pero también viene con clamidia también a veces. Y ese tratamiento es antibiótico, es muy fácil el tratamiento y se cura con antibióticos. El otro tipo de infección no es bacteria, es otro organismo que se llama trichomoniasis. Y eso también se da también un tipo de antibiótico y a veces estamos encontrando más resistencia a los antibióticos con este tipo de infección. Cuando uno tiene las infecciones así, se recomienda también que uno regrese un poquito tiempo para estar seguro que se les quitó. También tenemos que dar tratamiento a las parejas. Todas las parejas han pasado 3 meses para estar seguro que no lo va a contagiar otra vez de nuevo. So the most common STI in the area is chlamydia. And usually it's asymptomatic until it becomes more severe and it can cause infertility in women. And then there's also gonorrhea, which we sometimes see in conjunction with chlamydia, but it's not as common here. And both of them are treated with antibiotics and it's a cure. Trichomoniasis is also a different organism that's also treated with antibiotics. And it can cause a lot of discharge, pelvic pain, malodorous discharge, which is different than gonorrhea and chlamydia because it doesn't actually cause those sorts of symptoms. The thing about trichomoniasis is that there's resistance to antibiotic therapy, so we do have patients follow up for repeat testing to make sure they've cleared their infections. And all partners in the last 3 months need to be treated, or else you'll just contract it again. One thing that some people think is they think that it can just reactivate. In those particular infections, once they're treated and we verified that you're cured of it, there's no reactivation unless there's re-exposure.
Right.
So muchos piensan que se puede como activar otra vez de nuevo la infección después de tratamiento, pero si ya tienes una prueba negativa después del tratamiento, si llegas otra vez positiva es porque ya ha tenido contacto otra vez una otra infección nueva. No hay inmunidad, so you can't get immunity to these infections. And it's really important that women who are sexually active, especially if you have new sexual partners, to get tested at least every year for this.
Right. Mm-hmm. So reinfection can happen, mm-hmm. and we can do tests of cure, mm-hmm. but it can happen if you have re-exposure, like Dr. Woodard mm-hmm. said. And we want to trace those partners up to 90 days prior to the diagnosis or prior to the exposure. Mm-hmm. So we always do contact tracing, and those people can get treatment as well. So that's really important. And then the other one, so we talk about chlamydia, GC, trichomona. The other one that gives us trouble is herpes. Mm-hmm. Herpes is treatable, mm-hmm. but it remains latent in your body, mm-hmm. and that's a problem. So mm-hmm. you want to talk a little bit about herpes, Dr. Wood? Yeah,
so herpes is interesting because there's 2 main types of herpes that affect us. There's herpes type 1 and there's herpes type 2. Historically, herpes type 1 was on the lips. People call them sometimes cold sores. Fuegos es un tipo de herpes que viene en los labios. And then type 2 is the type that's mostly genital. So type 2 historically was found as genital herpes. So en la parte genital fue el tipo 2, es donde se encontraba el tipo 2. So now with sexual practices changing, there is actually less distinction between type 1 and type 2. So ya hay cambios en cómo uno se tienen relaciones sexuales, so ya se encuentra el tipo 1 y tipo 2 en diferentes partes. So de todos modos se recomienda que uno tiene cuidado. Si tienes un fuego, lo puedes transmitir por contacto sexual. So an oral labial herpes can be transmitted sexually. A lot of people don't realize that the lesion on the mouth that they get when they're stressed out or when they have fevers or they're sick is actually herpes. That's why we also recommend, we tell people not to kiss their babies if they have an active infection, because that's how you pass it on to people. But what we do for herpes treatment is we treat to either, 1, help it go away faster, And two, we can, depending on how often people get recurrent symptoms, we can also give them medication to treat them for prevention.
Right.
So hay dos diferentes métodos para el tratamiento de herpes. Uno es, damos medicina antiviral para ayudar que se quita más pronto cuando uno tiene un fuego o un broto de herpes. Y a veces también si uno tiene herpes muy frecuente, como cada mes y es algo que no está muy bien controlado, damos a veces medicina que uno puede tomar cada día para prevención, para que no lo tienen el herpes con tanta frecuencia. Herpes is actually is highly transmissible before a lesion is seen. And so that's why we do recommend patients keep an eye out when they feel a tingling sensation, uncomfortable sensation that they know comes before they actually get the blister, because they're actually you're very contagious and you're shedding virus at that time. So.
Y es un problema porque herpes se transmite cuando no hay síntomas. So, a pesar de que no hay síntomas, se puede transmitir el virus. Hay más riesgo cuando hay lesiones activas, pero todavía el paciente puede transmitir el virus cuando no hay lesiones visibles en el área genital. Y los síntomas son unas vesículas pequeñas en grupo y tienen alrededor se ve muy rojo. So, se llama group vesicles surrounded by a red circle, red circle. So the initial infection is usually more severe. The other ones are less severe. But people can get really sick, and people, it's not a very comfortable feeling. So that's the importance of using condoms, because condoms help reduce the risk of not just pregnancy, but also STIs, right, Dr. Woodard? Yep. So we recommend. The other thing about las enfermedades transmitidas sexualmente es que es importante estar pendiente, porque si va el paciente con el doctor o la doctora y le hacen la prueba y sale todo bien, y tienen un compañero o compañera nueva, entonces tiene que estar alerta a la posibilidad de una infección nueva. O sea, a pesar de que se hizo una prueba relativamente reciente, pero si se adquieren nuevos compañeros de actividad sexual, entonces requiere un poquito de alerta, porque quizás hay que ir con el doctor o la doctora antes, right? So, new sexual partners, new activities create risk. And even though you've had your annual exams, they all look good, every time things change, you need to go, right? In some ways.
In some ways, yeah. So, it's not something where we recommend if you have a new sexual partner, come see us right away.
Right.
But if you have a new sexual partner and you have new symptoms, please come see us right away. Right. Sometimes it's not actually even a sexually transmitted infection. Sometimes it's just irritation, imbalance, things like that.
Condom?
I've had patients who have allergies to condoms. Right. So sometimes we just need to take a look and see what's happening.
Right. Just be alerta. Nuevos compañeros, los síntomas, desecho, dolor, ardor. Y a veces el ardor en la orina se puede malinterpretar como infección en la orina, cuando el problema no es en la orina, a veces es una infección en la vagina o en el cuello de la matriz. So sometimes that burning could come from the vagina and the cervix rather than a urine infection, right, Dr. Woodard?
Yeah, we usually, we talked about trichomonas earlier. So trichomonas, it can actually enter into the urethra and into the bladder. Okay. And so sometimes we'll get symptoms of a UTI, but we try to culture it and it's negative. And that's because trichomonas, or trichomonas, does not actually grow in culture. Okay. And we'll test for that to make sure that it's negative. Okay. But in general, vulvovaginal infections can be mistaken for UTIs, because when you urinate and you have inflammation and irritation of the tissue, it burns and it hurts. And that's something that we're actually really good at figuring out in the clinic. We have tests to do to check out the urine. We do urine cultures. We do STD screening. And we work really hard to figure out where their symptoms are coming from and how to treat it.
Right. So hemos cubierto hasta ahora cáncer del cuello de la matriz, cómo bajamos de riesgo con la vacuna. De ahí hablamos de enfermedades transmitidas sexualmente, los síntomas. Y ahora vamos a movernos a otro cáncer ginecológico, que es cáncer de los ovarios. Más difícil de detectar, porque no tenemos pruebas efectivas para detectarlos a tiempo. Cáncer del cuello de la matriz, tenemos el Papa Nicolau, la prueba del cáncer para hacer detección temprana. En cáncer de los ovarios, en general no tenemos esas herramientas a nuestra disposición. Hay ciertas poblaciones de mujeres con síndromes genéticos que hacemos pruebas, pero con cáncer de ovario no tenemos eso. So with ovarian cancer, we don't have the screening tools that we have for cervical cancer. A little bit more difficult to diagnose. It tends to present late. So, Dr. Woodard, can you expand on the symptoms and the lack of screening and what kind of symptoms should women be alert to that they should come to see us?
So it is a difficult cancer. Most ovarian cancers are caught in an advanced stage, usually stage 4. And there are no known screening that's been shown to prevent advanced ovarian cancer. When women have symptoms, it usually means they already have advanced disease. So ya cuando hay síntomas está avanzado el cáncer de los ovarios. The problem with the symptoms is that they're very difficult to interpret and to say this is ovarian cancer. Gastrointestinal cancers will present very similarly. Bloating, early satiety, which means like you get full quickly. Protuberant abdomen, fatigue. Even though the abdomen's getting larger, it's systemic weight loss. So it's very general symptoms that are very hard to pinpoint specifically to ovarian cancer. The times when cancer has been caught early in women, it's usually incidental, just good luck. It's not because they had screening, it's just that they had an incidental finding. If they were getting imaging for maybe appendicitis, or if they had a surgery for something else unrelated, some women are lucky enough to have it caught earlier. Also, women who have a family history and they get genetic testing that demonstrates the carry of certain genes that cause cervical, ovarian cancer, they will prophylactically have surgery at a young age to remove usually breasts, and a mastectomy where we remove breasts, and also a treatment where we remove ovaries and tubes. And sometimes it's actually caught at an early stage in that case. But we don't recommend that for people who are not at risk.
All right.
No,
I think more and more we are doing genetic testing for young women, particularly with breast cancer. And the same gene creates a risk for ovarian. So once you have those genes, BRCA1, BRCA2, and there are others, then yes, we look at the breast in terms of risk, but we also look at ovarian, and then the specialists, Dr. Woodard and others, help make a decision as to what other tests are needed, but also what treatment is needed. Because usually, in order to reduce the risk of cancer significantly, it almost always requires surgery. So for breast, obviously, mastectomy, and then for ovarian, the same thing. So, but it does require careful thought, analysis about everything. It's about the future, it's about risk, it's about surgery and the impact of surgery, the age of the patient. I mean, there's so many factors, but bottom line is symptoms, enlarging abdomen, discomfort, come and see the doctor because ovarian cancer is pretty common. And it's just not early screening.
No early screening.
Okay. Muy bien. So we're going to talk about menopause a little bit because it's bothersome for many women. So Dr. Woodard, can you define a little bit what menopause is? Because sometimes we tend to not think about what is menopause, what is that? And then what do you see in your practice in terms of common complaints that women have, but that treatment, you can help them with treatment. So can you talk a little bit about menopause?
Yes, so menopause is when the ovaries stop producing estrogen. And that's really the natural course over time. The ovaries will stop producing a sufficient amount of estrogen to have a menstrual cycle. So los ovarios dejan de producir estrógeno a un nivel que es suficiente para seguir teniendo una menstruación regular. Okay. With menopause, that loss of estrogen creates many symptoms. The primary symptom are hot flashes. So, con la falta de estrógeno, el síntoma más común, más severo son los bochornos, también se llama sofocos. It's just sweating. You're hot. Everyone else is cool in the room, and you're the hottest person. You're sweating. You're like, get me out of here. And everyone's like, oh, you're going through menopause. Right. So, we kind of joke about it sometimes, but it can actually be very, it can have a significant impact on your quality of life. Imagine you're trying to get a good night's sleep and you wake up 3 or 4 times in the middle of the night with a hot flash. Right. And then you're tired, you're cranky the next day, then you have hot flashes all day long, you're in meetings, you're at work, you're trying to help with your kids and your family, and you feel uncomfortable. And it's not just a mild nuisance for some women, sometimes it's a significant stressor on their lives. So a unas mujeres puede ser puede venir muy frecuente, afecta la calidad de la vida. Si viene muchas veces en la noche, no puede dormir uno, tiene mucho cansancio el día siguiente, no puede seguir haciendo las cosas durante el día sin esa molestia. Y es algo, hay muchos efectos secundarios. A veces hay depresión, ansiedad, afecta tus relaciones con otras personas. Si estás muy enojada, estás gritando a todos, estás irritable, todo eso. So, you're angry at everybody, you're yelling at everybody. You feel miserable. So then, people, that's usually the common complaint that people come for. With that complaint, everyone is different. Some women will have 1 or 2 hot flashes when they go through menopause, and they're fine. They're like, it's no big deal, I'm fine, I feel great. And then other women, it'll continue for months and months. And then there's some unlucky women who it'll continue for years, and there's women who will actually never go away in. And it's just a matter of how severe is it to kind of help us guide your treatment. So nomás dependen en qué tan severo están los síntomas. Y si vienen muy seguidos y no se te quitan, puede durar nomás un mes, años, y a veces por siempre. So what I always do is I ask people, how bad is it? How does it affect you? How does it affect your life? And then we talk about treatment options. Depending on your risks and your overall health, we have just natural remedies, which is exercise, maintaining a healthy weight, meditation, avoiding things that make you feel really hot, like a hot cup of coffee at night might be something you want to avoid, avoiding a glass of wine before bedtime, doing like exercises, calming exercises like yoga, Pilates, Tai Chi, and then maintaining a healthy weight, because any extra weight will make you feel hotter. Right. And so hay remedios nomás del estilo de vida que puede ayudar. So mantener un peso saludable, comer saludable, hacer ejercicios, meditación, yoga, Pilates, Tai Chi, cosas donde puedes estar más calmada y evitar café en la tarde, evitar el vino antes de dormir. Eso puede ayudar también. Staying calm can be helpful, because sometimes it feels like you're like a panic attack, like you feel palpitations. People feel like they're having a heart attack. It's especially if it's the first time. It can come out of nowhere, and people think that, oh my gosh, like I'm dying. But usually it can sometimes just be a hot flash, especially if the first time you've had it, you don't know. So a veces uno piensa que tienen un ataque de ansiedad o ataque de corazón y hay un pánico y eso, y si es la primera vez también, pero usualmente si uno se queda muy calmada, se quita eso. So it doesn't last forever, it just happens, it just lasts a couple minutes and then it goes away. The other treatments include hormone replacement therapy. So el otro tratamiento es dar hormonas, porque los síntomas vienen de la falta de hormonas. So a veces, pues si tienes muchos síntomas, a veces es más simple nomás reemplazar las hormonas que le falta uno. And so we will, if you're an appropriate candidate, if you don't have any risk factors, that's sometimes actually the best treatment. And then there's also women who only have like one symptom here or there. And so we can do medication that's not hormonal replacement therapy. We can do antidepressant medication. So if your symptoms aren't necessarily related to having too many hot flashes, but you're just very moody and very depressed and anxious, there's medication we can target just on that. If it's just problems with sleeping, let's say you only get hot flashes at night and not during the day, we can give medication that helps you sleep and also reduces hot flashes at night. That's non-hormonal. So we can kind of target therapy with that. But sometimes people have a lot of different symptoms. They'll have the hot flashes, they'll have the mood changes, they can't sleep, they're irritable, and their lives are really negatively impacted by menopause. And usually the best solution in those situations, and it's a case-by-case thing, it's usually hormone replacement therapy.
So I think what you're saying is that, the patient should come in, be seen, and like you said, the treatment should be targeted.
Mm-hmm.
Sometimes the treatment could be topical. It could be, something a symptom in the vagina that's
Mm-hmm.
bothering the patient. On the other hand, it could be more systemic.
Mm-hmm.
And medication could be helpful depending on the risk and the degree of symptoms. There are several options. So that's the importance of coming in, listening to the patient, and then making a determination what's the right thing to do.
I'm glad you mentioned that, because one of the symptoms that happens years after is vaginal dryness, or vaginal atrophy. So uno de los síntomas que viene a veces años después es resequedad vaginal. Y eso es algo que unos vienen conmigo con síntomas de dolor, ardor, sangrado, y eso afecta la vida sexual también. Mm-hmm. Y vienen conmigo y yo les digo, es por la menopausia, y unos piensan, pero ya pasé la menopausia. Mm-hmm. Y yo les digo, mira, te falta esas hormonas. Y con tiempo hay muchos cambios vaginales. Se pone seco, menos elástico, y eso se empeora con tiempo. So, people come to me and they're like, hey, I have these symptoms. Like, oh, that's because of menopause. I'm like, that happened years ago. I'm like, no. Menopause is a permanent state. You're not making the hormones. And then the delayed effect is the changes in the tissue, the vaginal tissue and the mucosa there. And so one of the best treatments we have for that actually is topical estrogen. And that is not something that is systemic, very low risk. It can be given decades after menopause. It can be given even in women who have had a history of breast cancer, even hormone-positive breast cancer. When we consult with their oncologist, we always make sure we get their approval. But it's a very low dose, it's very safe, and that can usually alleviate a lot of symptoms for that as well. And so and we have a lot of other wonderful recommendations for our patients as well.
So we can make them feel better.
Yeah. Mm-hmm.
And there are a lot of things that Dr. Wood or her team can do to help alleviate those symptoms, whether they're local or more systemic. They're good things. Thank you, Dr. Wood. Just briefly about menopause, there's some bone loss with it.
Oh, yeah.
Come over time because of estrogen deficiency. So typically there are some recommendations to order a bone density test. We follow various recommendations, but typically women over 65 should have a bone density test just based on age, but younger women over 50 can also have it. Dr. Woodard needs to leave, so I'll finish. Dr. Woodard, thank you very much. All right, thank you. I just finished that the bone density can be done women over 50 and above with risk factors. So we'll do a bone density test. depending on that, and then the treatment will depend on that. So that was something I wanted to mention. And Dr. Wood is back. So I was talking about the bone density test, Dr. Woodard. So women were 65, and then 50 and above with risk factors. And we use a scoring system called the FRAX system that gives us a percentage of a lifetime fracture risk and also a risk for hip. And we determine which treatment. There are medications available called the biphosphonate, which are probably the most effective ones. We have to be careful how we use those drugs based on if they have esophageal problems, strictures, things like that. But that's something that you talk to the doctor. Hablo de, después de la menopausia relacionada con la deficiencia de estrógeno, la densidad ósea puede bajar. Hacemos una prueba de la densidad del hueso en mujeres de 65 o más de 50 con ciertos factores para determinar el tratamiento. And then finally, to end our session today, just wanted to make a brief comment about the importance of seeing a doctor if you have any bleeding following menopause. We call that postmenopausal bleeding. And that could be an issue. I'll let Dr. Woodard expand on that, because that's something that is important, because we need to work it up. We need to do testing. Dr. Woodard.
So postmenopausal bleeding is usually benign, but it is also the first sign of uterine cancer.
Right.
So, sangrado después de la menopausia usualmente es algo benigno, pero también es la síntoma primaria que viene con cáncer de la matriz. The good thing about that, though, is that almost all uterine cancers are found in stage 1 and easily treated with a hysterectomy and without even the need for any chemotherapy or radiation.
Right.
So, lo bueno es que cuando se encuentra cáncer de la matriz, usualmente se encuentra cuando está en un nivel no muy severo, y la solución usualmente solamente quitar la matriz, una esterectomía, y es todo. A veces la mayoría no necesitan quimioterapia, radiación, nada. Es una cura. So the longer you wait, though, to be seen, that can change. So I always tell people, if you have postmenopausal bleeding, it is not normal. Come back and see us, and we can just check to see what's happening.
Right.
And that's the most important. The most important thing is just to have us do some exams. It usually is a pelvic exam, an ultrasound, and a biopsy are the things that we utilize to determine what's going on.
Right.
And it's great that we have something that the first symptom that you have is usually we can usually catch it at its early stage.
So, si la persona, mujer, sangra después de la menopausia, es muy importante venir con el doctor. Casi siempre, en mayor parte de las ocasiones, no es canceroso, pero una de las causas es cáncer del endometrio, que puede ser curable, se puede detectar en una etapa temprana y tiene cura. Eso es lo importante. Hay una medicina que se utiliza para cáncer del seno, se llama tamoxifen. Y tamoxifen está asociado con cáncer del endometrio. So, le pedimos a las señoras que han recibido terapia con tamoxifen que se lo mencionen a la doctora, al doctor, porque ese historial requiere un tipo de manejo, surveillance slightly different, por el riesgo más alto. So, aquella mujer que ha recibido tamoxifen, por favor se lo menciona al doctor, para estar seguro que monitoreamos un poquito distinto. So tamoxifen can be linked to endometrial cancer, so it's important to let the doctor know, so the doctor, like Dr. Woodard and her team, can determine the surveillance that may be different, right, Dr. Woodard? So it's really important to do that. So I think that concludes our session. We covered a lot today. Thank you, Dr. Woodard.
Happy to be here.
Thank you. We cover. One more thing. Almost forgot.
Okay.
We do circumcisions.
Yes.
I'm sorry about that.
That's okay.
So, first 2 weeks, you want to expand on circumcisions?
Yeah, so circumcisions is completely optional for newborn baby boys.
Yeah.
A long time ago, people said you had to do it, and then some people say you don't have to do it. We're very neutral. Some people choose to have their boy circumcised so that the boy looks like their dad, brothers, family members. Other people do it for religious reasons, and likewise, some people choose not to for the same reason. But we do offer that services. Even though as OBGYNs, we generally give the babies off to the pediatricians when they're born, that's the one thing we'll do for the first 2 years of life.
Yeah.
So, sorry, 2 weeks. 2 weeks of life.
2 weeks of life.
Yeah, and then any circumcisions usually after that will go to the urologist because as they get, we get them when they're still young and we can keep them really comfortable and they don't move too much. And then when they get older, then they need anesthesia to be put to sleep. And then usually urology will do that when they're older children or even adults. But the first 2 weeks of life, we do it in our department. So.
Muy bien. So, hacemos circuncisiones las primeras 2 semanas de vida. Tenemos una posición neutral. Hay razones que las personas tienen para hacerlo. So we cover a lot today.
Yeah.
Circumcision, cancer of the cervix, prevention, sexually transmitted infection, ovarian cancer, menopause, and postmenopausal bleeding. That we a lot today. So le quiero dar las gracias a doctora Woodard por el tiempo. I thought it was useful to you. Espero que haya sido útil esta conversación. Vamos a continuar con estas sesiones porque queremos hablar de cosas que son importantes. Es muy difícil a veces saber todo esto. Hay muchas cosas en la vida y cuando hacemos esto esperemos que damos información que puede ser útil y en ciertos pacientes hasta salvar la vida. Así que I want to thank everyone for being here. I hope the sessions are useful. We'd like to cover topics that are important for people so that they can come and seek care early to discover problems early when they're treatable and sometimes curable. So I want to thank Eladio, Mariposa, and everyone for your help. And I'll see you in the next session. Thank you everyone for your following. I'll see you later. Thank you, Dr. Woodard.
No, thanks for having me.
Muchas gracias. Bye-bye.